Hey Tyson, I'm Justin. I'm your physical therapist.
Justin, how you doing?
Good, good. I'm going to do a couple measurements on you.
Cool.
I'm going to do 3 measurements for your range of motion and 3 for your muscle testing. We're going to start with muscle testing, so I just want to test the strength in your muscles, make sure they're normal and there isn't any kind of deficits there or weakness.
Excellent.
So first thing I'm going to do is I'm going to start by looking at your scapula here, and I'm going to see if there's any kind of deformities going on. It looks pretty symmetrical. Alright, can I get you to go ahead and go through the range of motion? All the way up? Okay, now down. That looks good. So what I'm going to test here is I'm going to test your serratus anterior, and I'm going to do that by having you lift your arm up, thumbs up,
Okay.
to about 130 degrees.
Okay.
And now I'm going to palpate your inferior border, and I'm going to put a little pressure down here. And at the count of 3, I'm going to push some pressure down and don't let me break you.
Okay.
Okay? Resist me. 1, 2, 3. Okay, that was good. I'd give it a 5.
Excellent.
And now the next one I'm going to do is I'm going to test your flexion. So I'm going to have you go palms down to about here. And same thing. I'm going to put a little bit of pressure here, but I want you to resist me.
Okay.
And I'm going to stabilize you here right on your shoulder.
Okay.
And on the count of 3. 1, 2, 3. Okay.
Strong like an ox.
Strong like an ox. Strong man here, Penny Hardaway. And the third one I'm going to test is your trapezius muscles. So what I'm going to have you do is just make a shrug. Shoulders up to your ears. Okay. And then go ahead and do that again. Now resist me. I'm going to push down. 1, 2, 3. Okay. Good. Now I'm going to have you go ahead and go on your back, and I'm going to test some of your range of motion of your joints.
So you want me to have my head or my feet down here?
Your feet down here, head there.
Okay.
Alright. The first one I'm going to test is your knee flexion. So go ahead and if you can scoot back a little bit more, so we get some of more of your leg up there. Okay. I'm going to start in this position, and then I'm going to have you bend your knee up, and you're going to slide your heel on the bed, and it's going to come up just like that.
Okay.
Alright? And when I do that, I feel it's kind of a muscular end feel there. So I'm going to have the goniometer lined up, and I'm going to have the axis on your lateral epicondyle of the femur. I'm going to have the moving arm lined up with the lateral malleolus and the stationary arm with the greater trochanter. So I'm palpating for the greater trochanter here. I got that. Now go ahead and go through that motion again. Keeping the heel down. Good. Is that as far as you can get it on your own?
Yes.
Okay. Perfect. And that's 135, which is normal. Now what I'm going to have you do is I'm going to have you bend the knee again. I'm going to test the range of motion at your hip. So you're going to bend the knee up. And now you're going to bring your leg back. So keeping this knee bent, you're going to bring your knee back like this without moving your pelvis.
Okay.
So I'm going to go ahead and palpate here your pelvis, and then I'm going to have you go like this, and I'm going to feel, and it's more of a soft end feel. Okay, so I'm going to have you do that on your own, and then I'm going to line the goniometer up. The axis is going to be at your greater trochanter.
Okay.
The moving arm is going to be at your lateral epicondyle of your femur, and then the stationary arm is going to be lined up with the midline of your trunk.
Okay.
So go ahead and do that. Okay. Good. Good, and that's about 105. So that's good. I mean, that's within normal limits.
Okay.
Alright, can I get you to go on your stomach?
Sure.
And the final test here is going to be your hip extension range of motion. So what we're going to do, and I'm going to stabilize you here, and I'm going to palpate for the ASIS. I'm going to stabilize your pelvis, and I'm going to have you keep your legs straight. Don't bend your knee, and you're going to raise your leg up like that. Okay, I'm going to get my landmarks here. So that it's the exact same landmarks as the hip flexion. I'm going to have the axis at the greater trochanter, the moving arm is going to be the lateral epicondyle of the femur, and the stationary arm is going to be the midline of the trunk. And go ahead and go through that motion.
for a second.
Good. Good. So it looks like you got about 15 degrees of hip extension, which is within normal limits.
Excellent.
So I appreciate it, Tyson. You can go ahead and get up. And thank you very much.
Cool. Thank you.